Okay, and I'll mute myself. Go for it.
Okay. Thank you to the Newark community for joining us today as we present our education on hypertension, the silent killer. Your presenters today are Kayla Casal, Shante Glasgow, Lisa Lawson, and Tim Renna. Next slide, please. Our objectives include: what is cardiovascular disease? What is hypertension? We will discuss Healthy People 2030 objective, identify prevention measures for hypertension, our health promotion plan. We'll identify barriers for the elderly when seeking health care, what are advanced directives, and importance of advanced directives. Next slide.
So cardiovascular disease is defined as a type of disease that affects the heart or blood vessels. About 655,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. Coronary heart disease is the most common type of heart disease, killing approximately 366,000 people annually. In New York State, cardiovascular disease accounts for 35% of all deaths statewide in 2018. 20% of New Yorkers age 65 and older reported having some type of cardiovascular disease in 2018. High blood pressure, in addition to high blood cholesterol and smoking, are key risk factors for heart disease. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. Blood pressure normally rises and falls throughout the day, but it can damage your heart and cause health problems if it stays high for a long time. Hypertension, also called high blood pressure, is blood pressure that is higher than normal. In 2017, new guidelines for hypertension management were published and defined high hypertension as a blood pressure at or above 130/80, and stage 2 hypertension is defined as a blood pressure at or above 140/90. And there's a chart on this slide here that gives you more details on what the stage 2 is, and then hypertensive crisis. Risk factors include elevated blood pressure, diabetes, unhealthy diet, physical inactivity, obesity, too much alcohol, tobacco use, and genetic and family history. Some facts about hypertension. Having hypertension puts you at risk for heart disease and stroke. Nearly half of adults in the United States have hypertension. Only about 1 in 4 adults with hypertension have their condition under control. High blood pressure costs the United States about $131 billion each year. A greater percentage of men have high blood pressure than women, and high blood pressure is more common in non-Hispanic Black adults than in non-Hispanic white adults, non-Hispanic Asian adults, or Hispanic adults.
I apologize, I forgot to put my camera on before I shared my screen. Our Healthy People 2030 objective is to increase control of high blood pressure in adults. With this goal, it's to get the percent of adults aged 18 years and over with high blood pressure under control. As of 2013 to 2016, the baseline was 47.8% of adults. The target goal is 60.8%. In Albany County, between 2013 and 2014, there were only 30.8% of adults with physician-diagnosed high blood pressure. And of that very small percentage, only 63.6% of those diagnosed reported taking their high blood pressure medication. Primary prevention of hypertension would be aimed at preventing the disease before it exists. So measures include eating a healthy diet, keeping yourself at a healthy weight and a lower BMI, being physically active, not smoking, limiting alcohol intake. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1 alcoholic drink per day, and getting enough sleep.
Secondary prevention is focused on reducing the impact of a disease or injury that has already occurred. Secondary prevention of hypertension includes continuing all of the primary measures in addition to doing frequent blood pressure checks and setting a blood pressure goal with your provider. Pharmacotherapy may be started with lifestyle changes depending on the hypertension stage. If using canned food, use those marked reduced, low, or no sodium. Use spices and herbs to add flavor to food, which can reduce need for salt. Reduce the salty six, which is breads, rolls, canned soups, cold cuts, pizza, poultry with added sodium, such as pre-seasoned fillets and chicken nuggets, and burgers from fast food restaurants. Choose fresh foods, increase fruit, vegetable, and whole grains and nuts, and continue to limit your alcohol use.
According to the CDC, the definition of tertiary prevention is managing disease post-diagnosis to slow or stop disease progression through measures such as screening for complications. Complications related to hypertension, also known as high blood pressure, can affect the health of your eyes, heart, and kidneys. High blood pressure causes damage to the tiny, delicate blood vessels that supply your eyes. Bleeding in the eye, blurred vision, and loss of vision can occur. Vision changes are usually associated with other issues such as stroke and heart attack. To prevent eye damage or vision loss, blood pressure control is important. Routine visits to the eye doctor or ophthalmologist are necessary to prevent, diagnose, and treat eye damage. High blood pressure can damage the arteries in your heart by making them less flexible, decreasing the flow of blood and oxygen. When the heart does not get oxygen and blood flow, the heart muscles begin to die. The longer the oxygen and blood flow is blocked, the more severe the damage. The damage to the heart muscle can lead to heart failure or heart attack. Controlling blood pressure, eating a low-salt diet, and exercising regularly can decrease or prevent heart damage. Seeing a heart doctor or cardiologist is necessary to prevent, diagnose, and/or treat heart damage. High blood pressure can lead to decreased blood flow to the vessels of your kidneys. If your kidneys' blood vessels are damaged, they may no longer work properly, preventing the kidneys from removing all waste and extra fluid in your body. Extra fluid in the blood vessels can raise your blood pressure even more, creating a dangerous cycle and can cause kidney failure. Controlling blood pressure to prevent kidney damage is a continuous cycle. Seeing a kidney specialist or nephrologist is necessary to prevent, diagnose, and/or treat kidney damage. Medical management is extremely important to controlling high blood pressure. Taking medications as prescribed, not missing doses, and not stopping medications are essential to blood pressure control. In addition to medication compliance, lifestyle changes such as maintaining a healthy weight, quitting smoking, managing stress, following a healthy diet, including less salt intake, and being physically active can also decrease or prevent complications related to hypertension.
So this is our health promotion plan. The picture on the left are complications of persistent untreated high blood pressure. As Shantae just explained, it can affect your brain, eyes, heart, blood, and kidneys. Our health promotion plan will be strictly educational. It's about getting the info out into the public. According to the Albany County Health Department, in 2013 to 2014, only 9.3% of adults reported taking a class or a course to learn how to manage their chronic disease or condition. We would make a pamphlet with a condensed version of the information that we've presented to you today and hand it out locally. Included in the info would be primary, secondary, tertiary prevention measures. Also included in our pamphlet would be a link to a local support group and an education tool. The support group is called Mended Hearts. It's offered through St. Peter's Health Partners. It's for those who have had heart surgery or who have heart disease. The educational tool would be the Healthy Capital District Initiative. They have a program for heart disease, and it gives a list of tools and resources that may be helpful for interested people. Plan for an ongoing assessment would be to monitor the pamphlet use and to take a tally at local support groups or education classes. I think we've all taken a survey like, hey, how did you hear about us? I think it would be kind of cool to say, oh, I got this pamphlet and it was helpful, so I thought I'd check it out. And hopefully their response would be that they got the information from the brochure that we made up. And also we'd want to monitor the percentage of people who have taken a class about the disease. And hopefully that number would increase. Compared with younger adults, the elderly population often have higher demands for healthcare, which can be ascribed to the decline in physical function and increase in age-related diseases. The United States Census projects that by 2050, more than 20% of the total US population will consist of older adults. Healthcare barriers for the elderly include affordability issues like copays, access to health insurance, age-related factors, including mobility issues, vision or hearing impairment, multiple comorbidities, education level. They often feel like a burden on their caregiver, which can cause feelings of anxiety or depression. They may have transportation issues. They may have lost their license or they're not able to drive anymore. There may be the lack of proper transportation in their area, and this gives them a feeling of loss of their independence. Previously, they may have had a bad experience. They may have felt rushed or undertreated, had a poor communication with their healthcare provider, make them feel like they were not heard or understood, or there may be a lack of proper translation equipment for those who don't speak English. Because of these barriers, advanced care planning is something that needs to be addressed. It is a process of planning for your future medical care in case you are unable to make your own decisions. It is a continual process and not merely a document or isolated event. It allows you to maintain control over how you are treated and to ensure that you experience the type of care and the type of death you desire.
Advance directives are important documents for you to express your wishes if you are unable to express them yourself. Two of the most important documents are the healthcare proxy and the medical orders for life-sustaining treatment form, most commonly called the MOLST form. The healthcare proxy can be completed at any time, anywhere, and the MOLST form needs to be completed with your physician or nurse practitioner. For additional information, you may check this website that's on the screen here from the New York State Department of Health on advanced care planning. The healthcare proxy is a 1 or 2 page document that allows you to generally assign 1 or 2 individuals to express your wishes when you are unable to. These individuals you select should be willing to do so and follow your directions. You should have a conversation with them prior to their selection. This form is quite self-explanatory, but here are some key decisions to consider. You will need their name, home address, phone numbers for your healthcare agent and the alternate. You may select an expiration date or circumstances in which this proxy is not valid. You may provide optional information such as limitations to their decision-making capabilities, or if you wish to have such treatments as a feeding tube, liquid nutrition, or trial intubation. Be specific as possible. You may provide guidance on anatomical gift or organ or tissue donation. You must sign the document. You need to select 2 witnesses, anyone except your health care proxy or their agent or their alternative, would need to be your witnesses. You need to make copies and provide them to your proxy, your alternate, and to hospital and medical providers. The second form is extremely important, is the MOLST form. The form is generally pink. This form must be completed with your physician or nurse practitioner. They will be able to provide you with the best guidance. This form allows you to indicate to the medical professionals if you choose to be resuscitated. Resuscitated is where the medical professionals will CPR if your heart and or breathing was to stop. Choose to allow or disallow other life-sustaining treatments such as intravenous fluids, feeding tubes, liquid nutrition, and intubation. Some important information. So you need to complete the identification sections such as your name, your address, and your date of birth. Next.
Sorry.
That's okay. Section A is about resuscitation. Do you want CPR to be performed, or do you want to be designated a DNR, which is which is do not resuscitate. The other sections on this page are more about giving your consent. So section B is where you would actually sign your consent to being a DNR or want CPR performed. Section C is where the provider would sign off. And section D is where you would indicate your other advanced directives, such as your healthcare proxy. Section Section E is where you would indicate other life-sustaining measures, such as treatment guidelines indicating any limitations on treatment, or if you wish to be considered comfort care. You would provide instructions on if you wish to be intubated or be put on life support. If you wish to be transported to a hospital or stay in a location where you reside, such as your home or the nursing home. Do you wish to have feeding tubes and antibiotics? There's a space on there to give your consent and a space on there for your provider to give consent. Next section. Section F is actually a space where the medical provider reviews and updates your mulch form as needed. And there's also this form, part of the form would be used if you were to make any changes to the form. Advanced directives are important documents to have. These documents allow you to speak for yourself or to have someone speak for you. Completing the mulch form takes a terrible burden of having family members guess what your wishes are, or even start a family feud between family members that will last far past the time you leave them. That's actually the end of our presentation today. Thank you for joining us.